Everyone, can you hear me okay? Is this working sufficiently? Maybe I need to turn this on. How about now? Is this working well now? No. Okay. That's good now. Working now? I'll have you stand close, okay? Good morning. Welcome to our rally to reopen nursing homes to families. My name is Bob Beacon. I have been elected to be spokesman for this get-together this morning. However, behind the scenes, we have two ladies who have organized this event. And we call attention to them right now, Amy Dieters and Elaine Kushak. Thank you very much for organizing this. I have a personal stake in this dilemma. My wife, Judy, is a resident of nursing home. She's been here 13 months. I have not seen her for 6 months. I'm talking about my wife, Judy, who is a resident here. Can you hear me? Okay. All right. Separation's been difficult. We need physical, face-to-face contact between our loved ones and family members. Everyone is stressed and worried. Restrictions need to be lifted now. I have a letter next I'd like to read. And, excuse me. This is a draft letter to media outlets, but it speaks to our cause and it's worth reading. As this pandemic rages into its 6th month, we are appealing to you to help to shine a light on the unthinkable fact that so many families in New York are still not permitted to visit their loved ones in nursing homes. All these nursing home residents know is that they feel isolated, scared, abandoned, and alone. This has gone on long enough. Silence is no longer an option. In July 2020, the New York Department of Health issued recommended guidelines requiring nursing homes to test both employees and residents on a weekly basis and not open any visitation of any kind until that nursing home has gone 28 days with no new positive COVID tests. If they get, one positive test, the clock gets reset. Since July, most families have been waiting for their nursing home to meet the guidelines so they can visit, only to have the 28-day clock reset when even one employee tests positive, even if that employee does not have direct access with residents. Many families have had the date for their visit rescheduled 4 and 5 times. They are losing hope. They fear they will never see their loved one again. FaceTime visits are able to happen in some cases. That is not enough. They need to be hugged. They need to be cared for by the one person they are most comfortable with, who's taking care of them for COVID. The New York Department of Health reports to Governor Cuomo. He made the decision to put the Department of Health's visitation guidelines into practice. Less than 25% of New York nursing homes are able to meet these guidelines and begin family visitation. Governor Cuomo is the only one who can change the guidelines that will allow thousands of New York families to see their loved ones after months of isolation. This is unthinkable. This is inhumane. How anyone can think that this is even remotely okay. Why not listen to the science and use 14-day quarantine, not 28 days? The very population that this guideline was put in place to protect is suffering the most from it. Governor Cuomo made a mistake in April by discharging COVID-19 positive patients into the nursing home. This guideline was not put in place to protect their loved ones. It was put in place to protect Governor Cuomo and our nursing home residents are paying the upfront price. On August 19th, AARP.org reported that several states, Indiana, Minnesota, South Dakota, and New Jersey, are expanding nursing home visits sure their loved one eats their meals with fear done, and soon when they are anxious and a little cranky during sundown, just as they had done for years before COVID-19 hit. The nursing home can allow these essential family caregivers that they deem critical to a resident's daily care and emotional well-being to provide comfort care that perhaps the nursing home staff might not have time to provide. They are tested once a week, just like the rest of the staff. The article goes on to say that the goal of these programs is to mitigate what Minnesota's plans call the unintended consequence of prolonged physical separation and isolation of the residents' overall emotional well-being. They are expected to stay in the room with the resident. This privilege can be canceled anytime if protocols are not followed. Other states, such as Massachusetts, are offering limited outdoor visits with full PPE for one family member per week. And they have absolutely no uptick in nursing home COVID-19 cases. Why is New York unwilling to even consider something like what these states have successfully done? Families have been reaching out to their local New York politicians to try to get some support on this issue to no avail. Many of us have listened in on virtual public hearings by the New York State Senate and Assembly on long-term residential care and COVID-19 and heard so many sad stories of families whose loved ones passed away alone. Many families have tried reaching out to the governor's office to no avail. The voicemail for the phone number of the governor's website has been full for the last 2 months. Commissioner Zucker of the New York Department of Health has responded defensively during the hearings as is seemingly unwilling to consider alternatives to complete lockdown unless the nursing home can meet guidelines that are completely unrealistic. Again, he reports to Governor Cuomo. It is unthinkable that Governor Cuomo is playing politics with the lives of so many helpless nursing home residents. We are advocating for those who cannot advocate for themselves. This is a story that has not gotten the media coverage it deserves, yet we truly believe that if more people were aware of what was going on, they too would be outraged. This is an appeal to our elected officials to help us accomplish opening the nursing home. Mr. Gerald Kayer, CEO here at the hospital, and I would like to thank him for allowing us to meet here. He has been very helpful in the preparation of this event. And Mr. Kayer, would you please come up and say a few words?
Thank you, Bob. Well said. And based on the response, you obviously have hit the core reason why everyone is with us today. When I became aware that you wanted to hold a rally, as the administrator responsible for the system, there was a little bit of nervousness. But I want to share with you this is a peaceful demonstration of caring and conversation. And that's exactly what this is. I'd be remiss, however, in not acknowledging how we got here. Back in February and March, when the pandemic was starting, there was a lot we didn't know. And we actually in New York State have been led and worked collectively with Albany to get to this point today. Governor Cuomo and Commissioner Zucker in those early days, working with healthcare, working with public health, began formulating a plan so that we could keep each other safe. Now move forward to September and compare what's happening in New York State to the rest of the country. We really have turned a corner and we're doing some good things. What I hear from you today is, how can we build upon that so we can visit mom, dad, grandma, and grandpa, and other family members who you've entrusted us to care for? That's a fair question. my experience with our leadership in New York State, when you put together the right solution, when you put together good rationale, people will work with us. Our leaders will work with us. Today is the first step in that conversation. How we can do it better, because in the North Country, COVID is not killing our residents. But I am concerned about loneliness. And people do die from loneliness. And together, if we can put together the right plan, we can create safe visits, irrespective of positives that are identified. We have increased testing in Lewis County, and so we are finding positives, as we should. And with that information, we're keeping our communities safe. So know that we will work with you and together with you to help carry this message forward. We will communicate to the Healthcare Association of New York State what we are discussing today, and with some additional advocacy, we can hopefully change the very restrictive visitations that guide us today. On behalf of Deborah Wirtz, our nursing home administrator, Eileen Carroll, our director of nurses, and all of the staff in the nursing home, thank you for entrusting us in caring for your family members. I can tell you, the leadership of the nursing home and the CNAs and LPNs and RNs miss you. They want to see you as well. And maybe with some good fortune, in the not too distant future, we'll be able to open our doors wider for you so you can be with your family members. Someone who's not able to join us today is Dr. Shirley Tuttle Malone. As you know, Shirley became the medical director for the nursing home back in January. She sent me a note, and if you indulge me, she would like me to read this to you. I wish to extend my apologies for not being able to attend the rally today, since I am working at the office in Beaver River. However, I wish to thank each of you for taking time to come to the rally and support this very worthy cause that hopefully will get the attention of some of our policy makers, so that we are able to change those policies affecting visitation in our nursing homes. Although I serve as the medical director, 1 year ago I was not the medical director. I was exactly in your shoes, the daughter of a nursing home resident at the residential health care facility. My mother resided in the nursing home from January 2019 until her death on December 2nd, 2019. It is out of that experience that I agreed to become the medical director. It is out of that experience that I have great empathy for this cause. I do know what it is like to go months without seeing loved ones. Currently, the facility has been closed except for a brief week when we were able to open visitations, only to be closed again. We have been closed 6 months. This is heartbreaking for you, the loved ones and family members of our residents. But the reason we rally is it is heartbreaking for our residents not to see you. During this unprecedented time, they simply are not thriving without their family and loved ones visiting. So once again, I thank you for attending this event. Hopefully, if others rally, we will get the attention of others, policymakers, to be able to proceed with safe visitations for our elders. That's Dr. Shirley Tuttle Malone. So on behalf of our organization, thank you for stepping up. Thank you for your engagement. And we will work with you to change the visitation restrictions. Thank you.
administration, our employees, they can provide the care that's necessary, and that you have the common sense. And that's the important thing. You have the common sense to do what's necessary to protect your family. So we look forward to helping you as much as we can. I'm sorry. So let's continue the fight. We will support you all. Thank you.
Thank you, Michael. We have invited the news media and elected officials to this event and asked for their support to our request to help us reopen the nursing home. I've contacted Senator Joe Griffo's office. Unfortunately, he's in Albany today and unable to attend, but we have one of his representatives here. His name is Brian. Brian, could you come forward and say a few words on behalf of Senator Griffo, please?
Good morning to you all. On behalf of Senator Griffo, who sends his regrets for not being here today, I'd just like to reiterate that Senator and all of us in our office, and quite frankly, our colleagues in government have heard your stories. And we are doing all we can to continue to press the Department of Health and the governor to allow for more visitation. Senator Griffo has been very vocal on this issue and will continue to be so. We support your efforts, and we need to hear your voices more, and we are behind you. Thank you.
Okay, Congressman Elise Stefanik is elsewhere today also, but she has a representative here listening to our conversations today. Her name is Mary Jo. Hello, Mary Jo. And Assemblyman Ken Blankenbush had a prior commitment, but he has a representative here. His name is Brian, and Brian, if you would also come up and say a few words on behalf of Ken Blankenbush.
Thank you for the invitation to be here today, and we support you. We are there with you. We've been doing a lot of case management, lots of phone calls since this all began. It's really become a 24/7 job for us all, but we do feel as well. I take a look at the example that my parents both have been through a lot of medical issues on both sides. And to see them go through that together, to be there, supporting each other, we know how important it is for communication, and that's our thing. It's communicate, 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 and we're asking the governor's office to have a dialogue with us so that we can move through this fairly and smartly as well. Thank you for your time.
Thank you, Brian. Any other elected officials locally are welcome to come up at this point and say a few words. If we have anybody in the audience here who would like to come up and speak, now is the time. Any board members of boards or elected officials? I hope we have accomplished today in our rally and the purpose of this rally. And appreciate everyone coming today. And thank you for that, showing up. We have a petition to sign. We haven't already signed it. Tables. So please sign it. Thank you.
We are working on a plan that will be compliant and haircuts and visits to an employed beautician will be happening shortly.